Well, welcome everyone to the webinar this morning. This webinar is focused on cervical cancer screening for PC Plus practices. My name is Loretta Dutel, and I'm the Operations Manager for the Delivery System Reform Unit here at Main Care Services. I am here with my colleague, Brooke McNaughton. She is the Quality Manager at Main Care Services. And also joining us today are representatives from the Maine Breast and Cervical Health Program within the Centers for Disease Control here in Maine. With that, we will start sharing slides and we will jump into our webinar.
Can you see my screen okay?
Yes, I can.
Perfect.
All right, you can go ahead and go to the next slide. Yeah, that's perfect. All right, so this is the agenda that we'll be going through today. I'll be providing a brief overview, introduction to Primary Care Plus and the quality webinars. We'll be discussing the importance of cervical cancer screening, providing an overview of the breast and cervical health program. There will also be a discussion about how to champion cervical cancer screening and breast cancer screening. And we will also be sharing a success story from one of the practices who shares their knowledge about implementing processes for screening patients. And finally, we will discuss a little bit more about the measures themselves, and we'll take questions that you have at the end. Great. Before we get started, you can put your questions that you have throughout the presentation in the chat, and we will plan to address those at the end. And Brooke will also be monitoring chat as well, so she may stop us at some point if there's a question that's relevant to what we're talking about. All right, so PC Plus. PC Plus started in June of 2022. This is just a little bit of background. And PC Plus changes sort of the way Main Care pays for primary care services. The goal of the program is to incentivize whole person care, the whole person care approach to healthcare and connecting patients to care that meets their needs, whether it's behavioral or physical health supports. This program also supports practice changes, so better supporting their patients and patient outcomes. As a part of this model, there are performance measures that we report out on quarterly to PC Plus practices. One of those performance measures is the cervical cancer screening, which we will be focusing on today. Next slide, please. So PC Plus has no more than 10 quality measures. These measures are posted on our website. The link is here. And we will be sending this PowerPoint along with the recording out to the group sometime after the meeting if you'd like to review the measures on the website. But the PC Plus measures looks at practice performance against their peers across the measures. Based on how the practices perform on the measure, they may receive a performance-based adjustment. As noted here on the slide, we are still working towards implementing the performance-based adjustments. And we will provide an update on that when we have a target date for those. We will also have a future webinar focusing on how the performance-based adjustments work. And once we have more information on that timing, we will share that as well. But really the goal, the overall idea is that better performance on quality will lead to better patient outcomes and care, and therefore a larger PBA, which will then impact the overall per member per month payment for your PC Plus practice. And so this is just a screenshot of what the quality reports look like with, of course, a fabricated practice. This includes the peer group designation, which you can also find on our website. It has the numerator denominator for the measure, including the percentage. Practices should, if they haven't already, receive their quarterly reports soon. I believe that they did go out already, so you should have those in your email boxes, and that went to the contacts that we have for Primary Care Plus. And so the goal of these quality webinars is to provide support to PC Plus practices on the PC Plus quality measures, which includes connecting you to best practices, inviting experts in the field who can share practical ways on how to impact these measures within your own offices for overall population and patient care. Our goal is to have at least one webinar per month in 2025. And please be sure to sign up to our e-messages. This is where we will be sharing these webinar notifications. Today, as I mentioned earlier, our focus is on cervical cancer screening with our partners from Maine Breast and Cervical Health Program. The services that they provide really do supplement the services offered by Maine Care Services, and the guidance and the expertise that they have on cervical and breast cancer screening coordinates well around the cervical cancer measure within PC Plus. And they can really help in supporting providing sort of that practical knowledge to ensure the best possible performance on this measure within your practice. I will at this time turn it over to Tricia Donnarumma from Maine Breast and Cervical Health Program. I can't talk this morning. To introduce herself and to discuss more about the importance of screening.
Thank you. Good morning. I'm Tricia Donnarumma. I am the data manager with the Maine Breast and Cervical Health Program. So we really appreciate being part of this webinar today. Today, I'm going to provide some facts about cervical cancer here in the state of Maine and why cervical cancer screening is so important. This fact sheet was developed by the Maine CDC Cancer Registry Program and provides information on cervical cancer in the state of Maine. The data is from 2021, and so 7.5 out of 100,000 females were diagnosed with cervical cancer in Maine in 2021. 1.4 out of 100,000 died of cervical cancer. 50% of cervical cancers were found at a localized stage, 36 regional and 12 distant. Cervical cancer is not currently a leading cause of death in the state of Maine anymore. And the 5-year survival rate is 72.7%. Some risk factors for developing cervical cancer are being infected with the HPV virus or human papillomavirus, exposure to DES in the womb, and then some additional risk factors are if you're already infected with the HPV virus, are having multiple children, long-term use of oral contraceptives, and smoking. Next slide, please. So cervical cancer is one of the 4 cancers we can actually screen for. Cervical cancer was once one of the most common causes of death in the US, but its increased screening has significantly decreased the cervical cancer death rate. In most cases of cervical cancer-related deaths occur in women who are never really screened or haven't been adequately screened, followed up, or treated for their cancer condition. 9 in 10 will survive at least 5 years if diagnosed at a local stage versus 2 in 10 at a distant stage. A little bit more Maine cervical cancer facts. Cervical cancer incidence steadily decreased from 1995 to 2019 and has remained steady since. In 2021, there were 52 new cases of cervical cancer and 604 survivors since 2001. 8 in 10 or 80.3% of women were up to date on their cervical cancer screenings in 2020. And then in the among the age group of 15 to 39, which is the young adolescent and young adult population, the most common cancers appear to be female breast with 22%, thyroid cancer, melanoma of the skin, lymphomas, and carcinoma of the uterine cervix at 6%. Next slide, please. So cervical cancer screening recommendations. So per the United States Preventative Services Task Force, for average risk patients, age 21 to 29, Pap cytology alone, they should be papped every 3 years. For age 30 to 65, cytology alone every 3 years, or high risk HPV testing alone every 5 years, or co-testing, that's the Pap, cytology and high risk HPV every 5 years. And then HPV self-collection has now been approved in the healthcare setting as an alternative for patients who face barriers to traditional screening methods. So, but the Maine CDC is here to help you fill that gap for your patients who do not qualify for Maine Care but are still low income. We can help you meet your cervical cancer screening goals by providing coverage for these important screenings. So Angie's going to do an overview of our program. So I'll pass it on to Angie.
Hi, yes, thank you, Trisha. Good morning, everybody, and thank you for being here. And again, thanks for the opportunity to let us come in and share some information about our program and how we can help fill, like we said, that gap. So I'm going to talk a little bit about our program and just give you some information and some history and just basically what our mission is. So the program here, the Breast and Cervical Health Program, we are here to help underserved, uninsured, underinsured individuals have timely access to breast and cervical cancer screenings and diagnostic services at no cost. The program helps reduce barriers for someone in need of breast or cervical cancer screenings and or those diagnostic services. NBCHP also may be able to help qualifying individuals with treatment of breast or cervical cancer or even some certain precancerous conditions. So a little history about the program. The program was established in 1990 under the US CDC National Breast and Cervical Cancer Early Detection Program, or also known as NBCC-EDP. The NBCC-EDP has 70 award recipients in all 50 states. There are also awardees in US territories and tribal organizations. Maine began participating with the NBCC-EDP in 1995. So we didn't start right at the inception of the national program. We came along 5 years after and joined. And we were named the Maine Breast and Cervical Health Program, or MBCHP. The program is overseen by the Maine CDC, and the Maine Breast and Cervical Health Program network includes primary care practices, specialty practices, mammography facilities, and laboratories. We currently have 167 providers throughout the state of Maine. The network and partnerships that MBCHP has ensures that access to services for those individuals who are enrolled in our program. And if you need more information about the NBCC-EDP, you can visit the website or you can contact us here at the program and we can get that information to you. So the Breast and Cervical Program has been able to proudly serve over 29,000 individuals since 1995. The program has paid for over 80,000 mammograms and 51,000 Pap smears. Because of the early screening program, here in the state of Maine, 10 women have been diagnosed with invasive cervical cancer and 652 women have been diagnosed with breast cancer. So in the end, as a result, the program saves lives by doing that one screening at a time. So I want to just talk about a little bit about our eligibility. We do have some changes coming down in the very near future, so I will highlight those as we go along here. Individuals have to meet our screening eligibility criteria. So I'm just going to talk about what those are. So the first thing is their income has to be at or below 250% of the FPL. All of our income is self-declared by the individual. The income is calculated before taxes and payroll deductions. Individuals with self-employment Their income is calculated after their business deductions. Individuals do have to be a Maine resident. There is no length of residency requirement for them, and our program does not ask anything about citizenship status. Insured individuals also do qualify for our program. So we consider copays, deductibles, and coinsurance. We consider those to be financial barriers to getting services. Diagnostic services also may not sometimes be covered under an individual's insurance. Services that aren't covered, oftentimes the individual that gets applied to their deductible, leaving that individual responsible for any balance due. Individuals that have Medicare Part B, unfortunately, do not qualify for our program. And the reason for that is because Medicare Part B does cover those screening services. So I will say anyone that's over 65 and they're receiving the Part A benefit only under Medicare, they still could qualify for our program. The next piece is anyone who has a full Maine Care benefit, unfortunately, again, they do not qualify. And just for the same reason that they don't qualify if they have Medicare Part B, Maine Care covers those screening services. However, under Maine Care, there are some limited benefits that an individual may have, such as they may have emergency services only, they may have limited family planning, they may have a spend down coverage, or they may have or Maine RX. If they have any one of those coverages, then they would qualify, potentially qualify for our program. So I'm going to go talk about our age requirement. Our age requirement is dropping down to 21. So anyone who is 21 and over will be eligible for our program. We right now are predicting that that age drop will be April 17th. So when that date comes along, anybody who falls into the age category 21 and over potentially could qualify for our program. And if you do have any more questions about the change in the age requirement, please feel free to outreach to us and we can answer any questions you might have about that. Okay, so I'm going to just talk a little bit about what is covered under our program. So the program does pay for an office visit. The office visit has to include one of the following or any combination of the following. So it can be just one, it can be two, it can be all three. So that has to be the clinical breast exam, the CBE, the pelvic exam, a pap test, and or a high-risk HPV, or you can do the pap test, the high-risk HPV together or alone, the co-test. As Tricia mentioned earlier, self-collecting HPV testing has recently been approved. There are some stipulations to that. So if you have questions about that self-collection, again, feel free to outreach to us here at the Breast and Cervical program. And at the end of this training, there'll also be some information in the resources as well. So when we're talking about the office visit has to include a breast risk assessment. That also will be covered. So any validated risk assessment model can be used. This can be the BRCA Pro, the Gale model, the Tyra-Cuzick. If a client is considered high risk, the program does not cover high risk follow-up. And again, if you have more questions about that, feel free to outreach to us. The other thing that should be happening during the office visit, a discussion of scheduling that mammogram should be taking place. But if if the only thing that was done during that visit was just that referral for that mammogram, then we wouldn't be able to pick up and pay for the office visit. So the other thing that Breast and Cervical program can help with is we can help reimburse for transportation and interpreter services if the need is there for a client. And next slide. So how do you get reimbursed for our program? So the Maine Breast and Cervical Health Program is really super easy to use, and it can be accessed by clients and or providers. Provider locations can work closely with the breast and cervical health program and incorporate easy workflows to help identify potentially eligible patients who can benefit from our program. Provider locations will have access to assisting clients with applying for the program, making a referral, or even assisting with the application. The breast and cervical program will soon have a new online application. The online application will make it easy to pre-screen potentially eligible patients and have access to being able to apply 24/7. The purpose of us, again, is to ensure access to breast and cervical cancer screenings. The more providers that we have in our network, the easier it is for patients to have access to these life-saving cancer screenings. The second thing that I just want to touch on is that data is super important to our program. The data that is provided to our program helps make sure the program gets adequate funding to continue to provide these breast and cervical cancer screenings, diagnostic follow-ups, and treatment services at no cost to eligible individuals in the state of Maine. When MBCH services are provided, they should be billed to the program via the main care billing system. The breast and cervical health program is not a main care benefit. However, we do utilize the main care billing system to process all of our claims. So when billing our program, just make sure that you're using allowable breast and cervical diagnosis and CPT codes that are allowed by our program. And we also make sure that all of our claims get reimbursed in a timely and accurate manner. If at any time you ever have questions about anything with the program, whether it be claims, billing, covered services, we are absolutely 100% here for you. The team here at the program will help find answers. We take comments and concerns very seriously, and the program relies on your input really essentially to help make the program easier to use for everyone. Next slide, here we go. And I just want to touch base on a couple of billing things that are specific to the breast and cervical program. So the program does reimburse for the office visit, as we talked about. It is an all-inclusive rate, and it is the non-facility Medicare rate. Included in the reimbursement rate is that room fee, the clinical breast exam, the pelvic exam, the PAP, HPV, or co-test. It's all in that. It's all in one rate. So the professional fee can be billed one of two ways. You can bill on the 1500 using our approved EM codes, or you can bill on the UB04 using, again, our approved EM codes, but also utilizing the revenue code 0960. And then there's one more special billing requirement that I like to kind of talk about when it comes to FQHCs and RHCs. So this may not pertain to everybody, but basically the program does not cover T codes. These are specific to main care only. So when a T code is billed and the claim is a breast and cervical claim, we do deny the T code line. When the FQHCs or RHCs bill for the office visit code, they additionally, they bill for that office code. And typically what happens if they're billing for that T code and the dollar amount is on the T code, there's usually a $0 on the office visit line, and we typically pay that at $0. We can only reimburse the office visit code. So if MBCH claims should have a $0 amount on the T code line, the reimbursable fee should be billed on the office visit line, not the T code line. You can just see the example below. Like I said, the T code line, we always will deny that. And then if it's billed, the EM code line with the office visit is billed at $0, then we do pay that at $0. So for UB04s billed with office visit codes, the revenue code, again, 0960 or 0521 can be used. If you do have further questions about this specific special billing, please outreach to us and we can help you clarify that and maybe even assist you if you're having trouble how to figure out how to get that to come through the system to us correctly. And so how can someone champion for cervical and breast cancer screenings? So basically, for cancer screening, these interventions improve the quality of cancer screenings and increase the number of people screened. So per the US CDC, EBIs are strategies that are proven to work. For cancer screening, these interventions improve the quality of cancer screenings and increase the number of people screened. So such things like client reminders, reducing structural barriers, provider reminders, provider feedback and assessment, patient navigation, those all can help improve cancer screenings. The Community Preventative Service Task Force recommends several interventions to increase screening for breast and cervical and colorectal cancers to reach both patient and the providers. And then, oh, I don't know what happened here. Everything just went blank. Oh, there we go. So now we're going to share a success story, and I'm going to turn it over to Brooke, and she is going to share that story.
Thank you so much. We can go ahead and go to the next slide. So I was able to touch base with one of the representatives from a facility that consistently performs really, really well in our primary care plus practice on cervical cancer screening. I can't speak to how they perform on breast cancer screening within our program because that's not one of the measures that we look at, but it is something that goes in tandem, right, as we've been learning with the EBIs, the evidence-based interventions that help improve both cervical and breast cancer screenings at a facility. I touched base with Tammy Dinsmore. I don't believe that she was able to make it, but a couple of things. She represented the Regional Medical Center at Lubeck, the East Machias Clinic. Again, they're doing really well consistently at PC Plus for cervical cancer screening. Two things that I really want you to know about this facility is one, they are an alum of the MBCHP, right? So they have worked very closely in tandem with the CDC program that you've been learning from today. And so the lessons that you're learning here have really, really informed. And this is from her mouth and just paraphrased by me, but they've really informed the practices that they've employed here. Something else is that they're also a member of the Maine Medical Association Center for Quality Improvement and Maine Breast and Cervical Health Program, Learning Collaborative Grant Group, right? So they do have a cohort that they're working with. So it's an intentional focus without being an intentional QI, right? So you can have a focus on quality without it necessarily being a quality improvement project. And that's something that she communicated to me is that they have a bunch of different efforts that they're employing, but it's not a very traditional quality improvement project, which I know that can feel overwhelming for some facilities. So really great, I think, example of how putting efforts in the right place can have some payoff. The bullets that you see on the bottom half of this slide are almost directly related to what you see on the evidence-based intervention slide. They employed what the MBCHP has advised. So they have pre-visit planning, morning huddles, standing orders, and then a lot of patient interaction. So they do mail, snail mail, email, going through the patient portal. They call when there's overdue reminders, and they include an info sheet. They also have a little bit of friendly competition within the facility, and they blind results and let their different providers know who's quote unquote winning for each different time period on performing well with their breast and cervical cancer screenings. And then finally, one plug is that they utilize our health information exchange in the state of Maine. That's Health InfoNet. Sometimes people call it HIN or HIN. And this is the place where you can find out if your patient has received their screening elsewhere, and then you can put that information in your EHR so you're able to keep everything up to date. If you don't already have a relationship with HIN, reach out to us, reach out to them. We can help facilitate that. So I wanted to just highlight them. I'm sorry that they weren't able to make it, but it was a really great, I think, way to advocate for small efforts in the right area can have some payoff. All right, so let's talk about cervical cancer screening as a measure. So we've been talking about the ways that you can improve in theory, make sure that you are serving your patient population, whether they are a part of main care or whether they are not. And if there are patients with main care churn, it can be important to know that you have MBCHP as a way to still pay for these services. When it comes to folks who are a part of PC Plus, what we're looking at is the patients who are attributed to you and whether or not they are receiving the care that we hope they're receiving, right? Like cervical cancer screenings within the last 3 years. So what I'm going to be talking about is exactly that measure and what it is we're looking at. A couple things to keep in mind. So the information that's on the report cards that Loretta showed you early on, the performance-based adjustment, the money calculations, that's going to be a subject of a later webinar. I'm not going into depth about that today. Also know that when it comes to cervical cancer screening as a measure, there are different payers and different stewards, and they use different specifications. So the numerators and denominators, the value sets, the billing codes, the criteria is going to determine your performance. It may be different from payer to payer. What we use is one that's pretty common, fortunately. It's from a payer, or we are the payer, but it's from a steward called the NCQA or HEDIS. So that's a pretty common measure, but it may be different from what you're receiving from other payers. The third bullet, sorry, if we can go back. The measure specifications are available via email and are also going to be available in Health Pass later this year. So if you want the specific specifications, what are the numerators, what are the denominators, what are the value sets, email us at the email at the very end of the slides. And then these slides will be sent out after. And then again, cannot reiterate this enough, following the main CDC's recommendations will lead to better performance, and better performance leads to better payment. Okay, so with all of that out of the way, let's go into the nitty-gritty of the measure, which is sometimes where we lose people, right? It's not always everyone's favorite thing. Fortunately, it's a pretty straightforward measure. So just like bear with me, stay with me, we're almost done. You've made it this far. So cervical cancer screening, the steward is HEDIS. That's what that is up there, HEDIS. And I'm seeing some information in the chat. How can you get providers added to your participation? Thank you for Trisha for getting that. Okay, so the measure itself, cervical cancer screening, represents a percentage of women, and the way that we measure that is upon enrollment. Do you have a cervix? That's what we're going to measure. So this measure represents percentage of women and people with a cervix ages 21 through 64 who were screened for cervical cancer using one of the following criteria. One, ages 21 to 64 who had a cervical cytology performed within the last 3 years. Whether it was done at your facility or not, if they're attributed to you, that's when you get credit. Women aged 30 to 64 who had the cervical HRPHBV, the high-risk human papillomavirus, performed within the last 5 years. And ages 30 through 64 who had the cervical cytology, high-risk HPV with every 5 years. These are the billing codes. These are the codes that we look at to see if this has been done. This includes things like self-collection, which previously mentioned is considered, there's research backing it up as high quality form of collecting samples. And I'm not going to go through every single one of them, but you can go, there we go, for billing questions. Specific to that, contact your provider relations folks, and then you have the email there. And that's the nitty gritty, right? So it's pretty straightforward. This is what we're looking for is, are you making sure that your patient is having their cervical cancer screening within the last 3 years, or if they're having that co-testing within the last 5 years? And that's by having a really good communication with your patient. If they've received it anywhere else, mark it in your EHR. If you are able to access through the Health Information Exchange, you're able to pull that down. Just that little bit of extra communication can go a really long way to making sure that these criteria are being met. Okay, final reminder. Sign up for e-messages. It's how we're communicating about these webinars. We did lead screening in children last month. Ones that are coming up, the next one is the total cost index in May. We're doing well child visits, which is in conjunction with developmental screening, and that's happening in June. And then just as a reminder, this series is intended to educate practices on how to optimize your performance and your payment while aligning with industry best practices for population and patient health. That's why we've been partnering with the CDC. And then in the future, we are, for total cost index and well child visits, partnering with similarly the experts in their fields to make sure that you're getting the best information and the best bang for your buck. So we are a little ahead of schedule. If there are any questions, any points of concern or discussion or things that you would like to know about MBCHP, about Primary Care Plus, now is a good time to ask it, either in the chat or you can raise your hand, and we would be happy to field those questions. Otherwise, we'll stay on for another 5 minutes and then close out the webinar. And we can actually probably go to the next slide so folks have the information on how to communicate with us. And if you're not sure who you want to field a question, you can always just send it to the very top one, and they'll send you to me and I can point you in the right direction.
I am going to stop sharing.
That sounds great. But yeah, if you have any questions, please do put them in the chat or raise your hand. We'll stay on for another 4 minutes. I do appreciate everyone being able to make it out on a Monday. For some of us, first thing in the morning, but still getting the yawns out, getting the coffee in. So it was nice to be able to share this information with you, and hopefully start the week out on an optimistic note. We will be sending out slides and the recording as soon as the recording is posted on our website. That usually takes about a week. So do keep your eyes peeled, especially those who showed up a little bit late due to my scheduling mishap, sending the wrong link in the original invite. So I apologize to those who did experience that.
There's a couple of questions that did come through chat.
Hey, we couldn't hear you.
Oh, then yes. Okay, so chat, and then also Janine, I saw that you were speaking. So Janine's fixing that. I'll go ahead and Caitlin Rawls, okay? I'll answer your question. So she says, I'm new to the PC Plus world, and I was late joining the call, so I may have missed this, but where exactly does the info get pulled from? Like which platform? That's a great question. So in PC Plus, we are claims-based. If you haven't seen the reports yet, it's worth a shot to ask around and figure out who's getting the reports. You can ask us who we're sending them to as well, to see how you're performing. And you can cross-reference your performance with how you're checking in on the performance internally and seeing if you're looking at the same codes that we are, because sometimes there is a disconnect there. So we are pulling them from claims. We have claims run out of, I believe, 2 months. So you have 2 months after the visit to submit those claims in order for us to count them toward that pay period. Does that answer your question? If not, please let me know in chat or go ahead and raise your hand. And then Janine, did you have something? I cannot hear you.
Okay.
Nuts. Oh, I heard you say okay, though.
Oh, now can you hear me?
Yes.
Well, this systems, what am I going to do? And this is Janine again from Breast and Cervical Health Program, and just wanted to reiterate one more time that we are dropping the age of eligibility to 21. We hope for an April 17th confirmation of that. I've got email addresses. All of us have worked together to get some email addresses. We'll send the notice out when it really goes into effect, but we're hoping for mid-April. Crossing fingers. Thank you.
I want to point out that there is a conversation in the chat if you've missed it. So folks who are interested in becoming a participating provider for the MBCHP, you can reach out to the email that Angela dropped in the chat or either of the emails at the end of the slides. We will get you pointed in the right direction. Someone asked, will there be new brochures after the age decreases to 21? Yes, MBCHP is currently working on updating our materials. Who would we contact to request new materials? Same thing, reach out to any of the emails. We will point you in the right direction. Angela Nile is the person for this, though. How do I get my name on the distribution list for the PC Plus reports? Contact your PR. So let me put that in the chat, the PC Plus email.
Yes, they can contact the PC Plus email address.
Yeah, I never know that one off the top of my head. I have to look it up.
Yeah,
it's on the slides though. So if you pull up the slides real quick, I can drop that in the
currently,
chat.
we send the reports to the contact list that we have for PC Plus. So yeah, if you can let us know at that email address, that would be wonderful.
I am copying it over right now. And the folks who field that email are really responsive. So you can expect to hear back within probably like a business day. Okay, we're at 10:40. I'm not, because some questions are still coming in, I'm going to hang out for a little while longer. Feel free to ask anything that is coming up about PC Plus or MBCHP. And then this is less official, but if you do have feedback about how this went, we'd love to hear back. We don't have any survey that is formal, but you're welcome to, again, put it in the chat or send us an email, fully knowing that not having the right Zoom link to start out probably wasn't the best experience for some of you. But if there's anything else, that would be really helpful for us to improve future offerings. Do we have anyone that is able to do a crosswalk with you to ensure the codes are mapped appropriately? Yes. So I'm going to send you my email. I'm just going to put it into the chat. And what I can do is we can set something up, and I can send you the specifications. You can become acquainted and to the level that you're comfortable, and then we can set something up after that to see how it's going. Sure. And that goes to anyone who's interested in the specifications or better understanding. I would also like that as well. If you could start with specifications, yes, please shoot me an email and I will send it out. All right, it feels like things are slowing down a little bit. Does that feel right to everyone, or is that just me dropping off of my caffeine in the morning? Okay, well, it was wonderful to start the day out like this. Thank you, everyone. Please don't hesitate to outreach us. Again, if you email the wrong person, we'll point you in the right direction. Everyone here is really happy to help. I can't thank MBCHP enough for participating in this. So round of virtual applause for them. Thank you so much for guiding us through evidence-based interventions and ways to serve the people of Maine. Thank you, everyone, and have a great rest of your day.
Thank you. Goodbye, everybody.